Today I want to discuss one of the most exciting advancements in cancer screening. It's called the Galleri test, and this is a blood test. It picks up 50 different cancers in their very early stages, and it does it through a DNA type technology. What's amazing about this test, it has an accuracy of 96%. It also has a specificity of 99.5%, which means that only 0.5% of the cases are false positives. What I love about it is because it picks up cancers at stage 1, these cancers can be cured. For instance, there have been many cases where individuals have been picked up with a stage 1 pancreatic cancer. The cancer was found about 2 centimeters. It was surgically removed. Patient was put on chemo, and these patients had a very long-term survival. Typically with pancreatic cancer, you don't find it until stage 3 or 4. That's typically when the symptoms start developing, and normally their 1-year survival is very, very low. These patients typically are deceased at about a year. So this test preferentially looks for very aggressive cancers like esophageal, anal, and it has a 96.3% sensitivity. So I would highly recommend, beyond doing the 6 different types of screenings that we have nowadays, to incorporate this Galleri test into your armamentarium. It does cost $999. Insurance does not cover it. If you can't afford that every year, at least maybe think about doing it every 2 to 3 years. But I do think it would be a really good idea to do that, especially if you're over the age of 50. And if you are getting cancer treatment, I do think it's a great idea because a lot of these chemotherapies actually cause secondary type cancers. It's been predicted that if we start incorporating this annually, we will be able to pick up 3 times the number of cancers at an early stage. And just so you know, the mortality rate over 5 years, if a cancer is picked up late, is 79%. If you pick up a cancer early, the mortality rate over 5 years is only 11%. So if you're interested in this, go to my website, naturalinsightsintocancer.com, hit shop, then hit nutrient monitoring. You'll see the Galleri test. I will then contact you. We will have a short chat beforehand. We'll get the requisition form filled out. You basically take it to Quest. They do the blood draw. I will get the results. I'll share them with you. And then if you do have an early cancer, then I would send you to the appropriate oncologist to do a workup. So hope that's something you take advantage of because I think it can really be a matter of life and death. So have a great day.